Today's guest is a physician. That much is straightforward, but her story is anything but. Brigitte Piniewski spent decades in traditional healthcare. She's a primary care doctor with obstetrics. She ran technology projects with large reference laboratory and published research. She did what medicine asked of her. Then she began to ponder, why is healthcare so hit and miss for individuals? What followed was a radical pivot. She stopped asking what was wrong with patients. She started asking, what if we could predict health before disease strikes? What if each of us owned our own data? What if staying healthy could actually make people money? Today, Brigitte is exploring what happens when artificial intelligence starts replacing work faster than cities can create new jobs. She founded Block Health. She advises startup founders. She sits on boards shaping the future of entrepreneurship. But here's what makes Brigitte's vision powerful alternative to the status quo. She believes that everyday data we generate through apps, through wearables, through simply living, our steps, our sleep, our meals, our social engagement is exactly the high quality information that healthcare desperately needs, but as of yet cannot access. And she believes we should own it, we should profit from it, we should control it. She calls it a secondary economy, not a replacement for work, but a parallel system that keeps human dignity and purpose alive as we navigate turbulent AI futures ahead. Her book, Wealth Care, makes the case that this isn't a distant theory, it's infrastructure we can build right now. As a mentor for Mentors for Women, Brigitte challenges us to think differently. This is about AI replacing jobs, about data privacy, about Web3 infrastructure, and about why the future of human stability might depend on answering one question: who owns your health? I am Virpi Tervonen. I'm proud to be one of the mentors at Mentors for Women. Today, I'm speaking with Dr. Brigitte Piniewski, also a mentor at Mentors for Women. She is a physician, an author, a strategist, and the woman challenging us to completely reimagine what value means when work itself is being disrupted. If you have ever wondered how AI will reshape not just your career, but your entire economic security, or if you have believed that your personal health data should belong to you, this conversation is for you. Brigitte, right now corporations own our health data. They profit from it. We don't. You believe that should change. What would actually make it possible for us individuals to own our data? What resistance have you faced to this idea?
Hi, Virpi. Thank you so much for having me. Yes, good question. It definitely all hinges on Web3, and we should start there because the systems that we have in place today really are all we could have expected from the current internet, which we call Web 2. And so let's start by defining what we mean by Web 3. Web 1 was the original internet. Remember when the internet started and all you could do was basically read a newspaper or an article on a screen. And that was so exciting. The exciting part was anybody with an internet connection could read something on a screen, regardless of who you were. However, then the internet expanded to allow transactions and websites. And that's where the division started to happen, where creating transactions, websites, commerce on the internet was something that companies did much better than individuals. And so with our Web 2 model, we have this absolute separation, this asymmetry, where companies have much more benefit through the internet than we do as individuals. And Web3 is basically this ethos that takes us back to the idea that the web should service us all. And now there are tools, digital tools, that allow us to actually envision a future where we wouldn't need to be a technical savant. We don't have to understand all of the ins and outs of the internet, but these tools allow each of us to begin to participate in the value production through things that people have probably heard about: crypto, NFT, tokenization. These are the tools behind the Web3 ethos that allows all of us to begin to participate again in the way in which the original web was intended to be, something that served all of us. So only because we've advanced this far, I often think about the Web 2 world that we're in now is an internet that's only half baked. Now it's fully baked because we have this extra set of tools, and we, the people, can begin to participate in co-creating the value that we need to have prosperous lives.
I'm really curious to hear what type of resistance you hear when they hear this idea of individuals owning the data again.
I think that this is something that depends on who you're speaking to. A lot of groups are already self-organizing. We have these groups called DAOs, distributed autonomous organizations, where individuals participate in co-creating the intelligence they need. For instance, there is a hair DAO, which includes over 1,300 men. They all participate by using various hair growth products and share that information among themselves, such that the next gentleman always benefits from every health experience that went before him. So this gentleman does not have to go through 20 products that are not going to work for him. He basically lives with a crowd in his pocket, and that crowd helps him navigate what actually will work for him in terms of hair growth opportunities. And so I think the resistance around, oh, you're asking too much of individuals, is falling away very quickly. But that clearly was a valid point. Previously, before Web3, we couldn't ask people to own their own data. We did need industry to self-custody that for us.
I wonder, you might or might not have any answer for this, but I'm really curious about this because this is about this centralization of the control, distributing it back to individuals from the corporations. Any idea or anything that you could say about corporations resisting this idea of the centralization of control of private data?
It's basically actually a win-win for corporations as well as individuals. Of course, corporations are suffering today with this burden of being that central repository of millions and millions of records, which of course is a single source of attack for nefarious operators. So we have a lot of difficulty with data breaches, ransomware. These are things that would be much less profitable for nefarious actors if there wasn't a honeypot of data. If, in fact, capturing a data stream means that all they have is Verpi's data, or all they have is Brigitte's data, which is unrewarding and unvaluable in isolation. So that's one of the things that would make it much more possible for corporations to get on board. Plus the fact that actually today corporations are suffering from the fact that they just have access to disease management, which is episodic moments of our lives, as well as billing data. The ebb and flow of our true health expression is not something that sits in the electronic medical record. That true health expression, of course, involves things that you mentioned earlier: your nutrition, your sleep, your movement, all of which drives your gene expression and actually provides you with your health outcomes at the end of the day.
But I love how you reframe it. It actually is beneficial for all parties involved.
Yes,
Fantastic. So you were a successful doctor working deep inside the traditional healthcare system. When did you realize that even with AI, health intelligence would still fall short?
As you mentioned in the introduction, I'm a primary care physician with obstetrics. So we did a lot of deliveries. We thought if we just did those 9 months of pregnancy and that delivery, we would be launching our babies off to 100 years of good health. But that clearly is not true anymore. In the book, I mentioned that our parents of older generations didn't have to know how to feed you, how to move you. We basically got good access to our genetic potential without necessarily earning or deserving it. That's not there for the younger generations. Conditions on the ground have changed so dramatically that it's not enough to not understand how much sleep, movement, nutrition your child is being exposed to. We thought it took 4 decades of suboptimal lifestyle to give us diabetes, heart disease, stroke. And what the children today are teaching us, that just not 4 decades, but just 4 years of a hormonally altered puberty driven by the conditions on the ground for kids today results in very early onset, not just physical manifestations, diabetes, heart disease, stroke, but mental manifestations, their socialization, their employment, their ability to thrive in all the domains of human functions can be impaired in just those 4 years of puberty.
You left traditional medicine to explore AI, Web3, and personal data economies. That's a huge shift. What made you do it?
As I mentioned, seeing the children and the fact, of course, that every 4 years we have another cohort of individuals going through puberty, and then we are unable to reverse that event for them in more optimal ways. I realized that seeing patients one by one was not solving the problem. And so I collaborated with a number of universities using technology to enable the smart household, the smart home. And we saw that we had the ability with technology to enable new data sets that linked nutrition activity with biological outcomes. However, the healthcare system really used that information and that research for purposes such as PR. The underlying operation of our health system didn't change. And so I began to just advise for startups that were working in this space, advise for startups and investors. And more of the startups were offering blockchain-based solutions, but the investors wouldn't invest because they didn't understand the technology. And that is not something that you can learn in an hour. And so I set up boot camps, so a 2 week boot camp where we would do 3 hours of online learning, 3 hours of in-person class, and over the space of 2 weeks, then we would all have at least a more solid understanding of Web3 blockchain and the potential for this technology to really improve not just our financial systems, but also our healthcare systems.
You talk about a secondary economy. What does that actually mean in simple terms?
Remember, Bitcoin didn't do anything to finance at all. It just showed up as this secondary option for individuals to participate in or not, up to themselves. And I see the similar situation as we move more and more into a future where AI is expected to displace jobs. And that means many of us are going to spend periods, significant periods of time in our life, either underemployed or unemployed. And of course, that is not just an employment issue, it's a social stability issue, one in which we really need to understand how to safeguard human dignity and purpose in life. And what this offers us is an opportunity to really recognize that we have AI and Web3. It could be perilous for humanity, or it could be an amazing utopia where each of us actually are rewarded not for the job we do, but actually for the life that we live. We mentioned earlier that AI currently doesn't have the training data it needs. It only has disease management and billing data in our current healthcare systems. But if it did have access to that ebb and flow of your health expression, we had the safe and secure infrastructure using Web3 technologies to use apps and wearables such that our movement, nutrition, sleep, and other parameters could be measured, that would generate an amazing amount of new knowledge. And new knowledge has always been the foundation of new wealth. I love the term used at the beginning, how healthcare is hit and miss. And Steve Jobs, Kate Middleton, these are individuals that are likely to have had really good access to amazing lifestyles. However, they remind us that we are all still walking blindly into very devastating outcomes that really, especially in Steve Jobs' case, did not have to do with their genetic material. This is pancreatic cancer. The vast majority is all often sporadic, which means it's not Steve's genes that caused this. There was an accumulation of events in his lifetime that he was unaware of, that we are still unaware of. And therefore, his health experience has gone to waste. And we're in this world in which many of us have health expression experiences that are going to waste because we haven't digitized them. Of course, apps and wearables are becoming more and more available. Our sleep is something we can track quite easily. Our movement is something we can track, increasingly nutrition as well. But we need a safe and secure infrastructure in order to accumulate that minutia. And the interesting thing is we also have many of us to support our intelligence. So unfortunately, 60,000 people a year in the US do get pancreatic cancer. Many more thousands, of course, don't. If AI had access to the minutia of those life streams, it would have a very reasonable ability to tell us well ahead of time that we're in this track that looks like pancreatic cancer is a possibility. And you and I would both like to know 5, 10, 15 years in advance, what are the things that are accumulating on our watch that might keep us in this lane with an outcome that we're not interested in. And so I see a future whereby we won't just have a handful of mega companies transacting on our data, but that actually we, the people, will be transacting on our data on a regular basis. Certainly there will be microtransactions in terms of value, but also have an opportunity through that volume of transaction to create a massive amount of wealth for ourselves and each other. In the book, I talk about a 3-zone model to make it simple for people to understand. So zone 1 is that home base. That's where you and I would keep all the minutiae of our lives using Web3 tools that safeguard our identity and manage to also certify that the things we put in home base are true events. And then sitting on top of home base is zone 2, which is a continuous correlations AI that is non-rivalrous in every way. There's no IP there. It just says these things are correlated. And that way you can make decisions yourself. And then zone 3 is the commercial layer. And that's where industry, government, researchers, people that are interested in getting all the way down to our individually specific data don't actually have access to that anymore, but they do have access to pre-licensed insights that are served up from zone 2 to zone 3. And in this 3-zone model, we have a means by which we could basically protect everybody on the globe in a universal manner. We can all benefit from each other's life streams because basically we have 8 billion of us doing life differently, all of which would be so informative to AI.
Thank you. Then you're not just saying AI will take jobs. You are calling it a social stability crisis. So why isn't AI taking the jobs simply about retraining people for new kinds of work?
Basically, there won't be enough work. The World Economic Forum is suggesting that we are losing over 40% of the workforce due to AI, which is an incredibly large number and really supports this idea that many of us will find periods of our time when we're not in traditional employment. And therefore, having a secondary economy that rewards us for the life we're living would make a lot of sense, given the fact that not only do we need to safeguard dignity and purpose, there's so much wealth to be had there. I provided an example of GLP-1 in a short post on LinkedIn, which might explain this well to your users, that the health that we experience on a day-to-day basis is so valuable. And so in this post, I talk about a gentleman thinking that he would like to take a GLP-1. That's the medication that many people are using for diabetes as well as for weight loss, those injections. He puts that information in his home base, and zone two says, wait, there's this correlation because, of course, when we have millions of people taking a medication, even the rarest of outcomes are likely to surface. And in this case, zone two mentions that there is a complication, sudden blindness in one eye, NAION, which is non-arteritic ischemic optic nerve disease. And that gives the individual a chance to recognize, oh, wait a minute, I do not want sudden blindness in one eye. What do I need to do about that? And the correlation suggests that perhaps it's associated with the size of your optic disc. That's the hole in the back of your eye where your blood vessels and your nerves come through. And you and I sitting here today don't know the size of our optic disc, but clearly our optometrists, our ophthalmologists, they have that in the records. And we can easily put those records on our home base, where then our AI would be able to inform us where we land in the landscape of sizes of optic discs. And then we could make an informed decision well before we wait for science to figure out if there is a causal relationship between this medication and sudden blindness. I wrote the article a few 9 months ago or something, and within a few months, the lawsuits started to surface. There's a gentleman in New Jersey who is suing because he has blindness in both eyes, not one eye. And he was prescribed the medication for diabetes, but no mention of this possible side effect, of course, happened. So this shows us how we, the people, can be aware of what's correlated because, in fact, we're the ones that are surfacing the correlations in the first place. And if we had a safe and secure infrastructure to ensure that no health expression goes to waste, we could have important information at our disposal, not just for our health benefit, but also for our economic benefit. I mentioned in the post about how that information, the size of your optic disc, and the fact that you're on a medication and having no visual complications starts to become very valuable information for the pharmaceutical company making that medication. And so you see an opportunity to have industry paying individuals for their individual health information. But in the three-zone model, this happens without industry having to know exactly who we are.
That is data privacy right there.
Yes, that would be the ideal.
So you mentor entrepreneurs who are building things that challenge the norm. How do you guide them, especially when someone's taking on big established systems?
I think that this is where folks like myself are of value because too often startups can build a technology that works really well, but they don't have years or decades of road rash from working inside these complex systems. And understanding what actually will be paid for or purchased is not always clear. And therefore, it's great to have somebody who will understand that your product is awesome, but we can't use it in this setting because of the way in which the money flows. And so that's what I find is most useful for startups to have a better understanding from individuals within the system of the roadblocks that may not be in the public domain.
Can you share one mentoring experience that really worked? What clicked between you and that person?
I think that sometimes it sounds obvious. You need to know who your customer is, but because of the work we do, it's not always translated clearly. So in this case, I was thinking of a colleague of mine who was a dentist, and she had a great technology to solve a dental issue. And she explained it all to the investors as if the investors were patients coming in for dental care. But in fact, her solution isn't going to be sold to the individual patients. It's going to be sold to the dentists themselves, which is a much better value proposition for the investors. They can see how this solution will, in fact, impact the dental practice to a large degree, and that dentists would be more than willing participants in purchasing this new solution. So just having someone help you with the way in which you phrase your solution to investors, that pitch narrative and the pitch deck is something that is really useful for startups.
From this interview, what is the one thing that you'd want everyone watching to remember?
I think you said it well when you said maybe the future hinges on who owns your health. I would hope that everybody understands that we are all physical beings. Therefore, currently today, we do own our health. We choose what happens to us at night and during the day to a large degree. And therefore, we are sitting currently at this position of advantage. But make no mistake, humanity is at a crossroads. We have a tool that I shouldn't even call it a tool because AI isn't really a tool. Historically, tools were things that people controlled. And Noah Harari talks about how AI is very different and cannot be classified as a tool because it can have both ideas and make decisions. Remember, the printing press was a tool that we built, and the printing press could print everything that humanity could think of, but it couldn't come up with any ideas of its own. And we built the atom bomb, but the atom bomb cannot decide to go off or in which direction. AI is very different. It does have the ability to generate ideas and to make decisions. A lot of the very successful entrepreneurs in the AI space are sounding the alarm. This is not something to sit back and wait for our leadership to take control and look after this. In fact, I was in DC in June, and it was disappointing to hear when we asked the panelists, what is your plan for AI job displacement? And the universal answer seemed to be, I have no idea. So in the space of no idea, even big ideas that we're talking about today really need to be surfaced. There has to be an opportunity for a strategy here, a strategy that understands the limitations of the current AI so that we have the current training data and allows us to create a secondary economy whereby the people participate for both health and economic benefit. I think that because of Web3, there is an opportunity to actually make this a reality. It's not something that we just need to talk about. And that's why I wrote the book, Wealth Care, Demystifying Web3 and the Rise of Personal Data Economies. It's hopefully something that anybody can pick up and be able to follow, because I really focus on examples, not the technology, but the lived examples, the lived experiences of individuals and how they look today and how they could have looked if we, in fact, were already down this path of having a secondary economy and a future with health intelligence that is going to incredibly far outpace the intelligence that we work from today.
Is there anything I should have asked, but I didn't?
I think one thing that we should probably suggest is talk about the tailwinds that we have. You mentioned one of them with the corporations not having access to the data that they would need to have good outcomes from AI. But another one, of course, is the fact that AI is so expensive to train and requires so much energy. And therefore, without optimal quality training data, it's going to be very expensive. And so I think even though it sounds like this is a drastic change for society, in fact, it may be just inevitable that we have to go this direction of a secondary economy, and that there is an opportunity to do it very safely and effectively, given the fact that we now have the trust frameworks that we can build using Web3 technologies. So there is a lot of tailwind here. This isn't a completely pushing a rock up the hill, but yeah, I appreciate your questions and I hope your audience finds this helpful. I would recommend other books as well. Shoshana Zu's book regarding capitalism, that's really excellent. And of course, George Gilder's Life After Google.
Thank you so much for this interview. Brigitte.
Thank you. It's been a pleasure.